I don't think socialized medicine is the answer, but at this point, again, I believe that our best option is to take private insurers out of it. The only way to do that is to go to a universal health care plan, which then increases your taxes. And I don't think the government does our best thing with our taxes. And I think that that is one of the issues, right? Like, nobody trusts what they're doing with our money. Because now that the bag has been opened on letting them go for profit, we can't undo it. And we need to undo all corporate medicine and all hospitals as for profit organizations and entities as well, and bring them back to not for profit, so that the dividends have to go back to the people who used the services or subscribed to the service. And honestly, I personally, when I first graduated PT school, worked in a clinic where 90% of my clients did not speak English. Most of them were there for a work comp injury that was severe. Like, not like, oh, I hurt my back. Like, oh, I got thrown off of those skyscraper window cleaner things, broke my spine, tore my ACL, broke my collarbone, collapsed a lung, and spent 6 months with a spinal cord injury at the hospital next door. And now I'm finally able to walk again, and I'd like to learn how to walk again because I need to get back to work because I need to provide for my family that's here. And I'd also like to send money back to my parents so that they're not struggling so much. These guys were being paid, legitimately paid, and some of them were so beloved by their employer that their employer showed up occasionally to their PT appointments. And they were immigrants. So the idea that everyone is freeloading is an idea in your head, and someone put it there, and you've blindly believed it without actually doing the research. And I think, in general, there are things that should absolutely 100% be covered. And there are ways to make it so that we can afford that system. Like, for instance, I don't believe that a child in any case under the age of 18 who's still going to school and trying to better themselves should have to pay for healthcare services that they need. And I don't believe that they should be limited based on the fact that their parents can't afford health insurance, because that's not that child's fault. It's not. I don't believe that child should go hungry either, because again, it is not their fault. They didn't ask for that. And sometimes, and I can speak from personal experience, those parents are doing everything they can, and it's still not enough. And they need things like SNAP benefits, and they need welfare, and they need housing assistance, because they're working 2 or 3 jobs, and they still can't make ends meet. And I think, beyond anything, if you actually worked with people, you would see how hard some of these people are working compared to the others. The system is broken. It's broken, and I don't know how to fix it except to make everyone go back to that's not privately owned. So if it's owned by a corporation, it's owned by a company, it's not owned by a single individual or 2 individuals, make them all go back to not for profit. But we're never going to get there. So the only next step is. And then, not unsimilar to what happens in the UK, people can buy their own private insurance for additional and spend that luxury money out of their own pocket if they wish, but it's not demanded of them. It's not their only option. It's not their primary option. They can go see whomever they like at whatever expense to themselves that they like. But all of this impacts the overall health and wellness of this country. And right now, 94% of Americans are failing at their health. 94%. So, how do we fix it? Can you come up with a detailed plan and write your congressman and tell them to get back to work? Because it's no longer just about people losing SNAP benefits on November 1st, which is not legal anyway and not the precedent this president has set before in his last term. It's about the millions of people who have not received a paycheck since this all started. The millions of servicemen and women, government employees, people with contracts associated with the government that have not received a paycheck since this whole thing started. And giving the executive branch more power doesn't solve this problem either. It doesn't. And if people on both sides were willing to give something up, and they were willing to stop lining their own pockets, and they were willing to go to single item bills, and they were willing to set term limits, we'd all be better off. But the only way to undo this is go back to private practice outside of hospitals, and hospitals and corporate care go back to not-for-profit, and insurers go back to not-for-profit. And I don't know how to make that happen, because no one at the government level right now is going to write that law, because they're pocketing from all of these companies, from lobbyists from all of these companies, from the stock investments they have. Hell, I bet you some of them even sit on boards. But you tell me, how do you fix it? Come up with a definite plan. Write the letter. Send it out to as many people as you can and get them to make adjustments to it. Sign their name on it and send it to their congressman. Send it to their senator.